Have you ever wondered what type 2 diabetes is and how it affects the body? In this video, we will type 2 diabetes, exploring its underlying causes, common symptoms, and related health conditions. What is type 2 diabetes? Type 2 diabetes is a chronic metabolic disorder characterized by impaired glucose regulation. Unlike type 1 diabetes, where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas, type 2 diabetes primarily involves a reduction in insulin sensitivity or the development of insulin resistance. This resistance means that the body's cells become less responsive to insulin, a hormone that is crucial for regulating blood sugar levels by facilitating the uptake of glucose into cells to be used for energy. As a result of this impaired regulation, glucose accumulates in the bloodstream, leading to elevated blood sugar levels, also known as hyperglycemia. The process of glucose regulation in the body is complex and involves multiple organs, also known as hyperglycemia. The process of glucose regulation in the body is complex and involves multiple organs, including the pancreas, liver, and muscles. In a healthy individual, after eating, the pancreas releases insulin to help cells absorb glucose from the blood. However, in someone with type 2 diabetes, the cells do not respond adequately to insulin, and the pancreas may initially compensate by producing more insulin. Over time, this increased demand can exhaust the pancreas, leading to a decrease in insulin production and further exacerbating the problem. Causes and risk factors. The impaired glucose regulation seen in type 2 diabetes is the result of a combination of genetic, environmental, and lifestyle factors. Understanding these factors is crucial for prevention and management. 1. Genetic factors. Genetics play a significant role in the development of type 2 diabetes. If you have a family history of the condition, your risk of developing it is higher. This genetic predisposition is particularly strong among certain ethnic groups. For instance, individuals of African, Hispanic, Native American, and Asian American descent are at a higher risk compared to those of European descent. Researchers believe that these groups may carry specific genetic variations that make them more susceptible to insulin resistance and, consequently, type 2 diabetes. Moreover, having a close relative with type 2 diabetes, such as a parent or sibling, significantly increases your chances of developing the condition. 2. Environmental and lifestyle factors. Environmental and lifestyle factors are also critical in the development of type 2 diabetes. One of the most significant risk factors is being overweight or obese. Excess body fat, particularly abdominal fat, can contribute to insulin resistance. This is because fat cells, especially those located in the abdominal area, release substances that can interfere with the normal action of insulin in the body. Furthermore, a sedentary lifestyle, characterized by a lack of physical activity, can further exacerbate insulin resistance. Regular exercise helps to maintain a healthy weight and improves the body's ability to use insulin effectively. 3. Metabolic syndrome. Another important risk factor is metabolic syndrome, a cluster of conditions that occur together and increase the risk of type 2 diabetes, as well as cardiovascular disease. Metabolic syndrome includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Each of these conditions can individually contribute to the development of insulin resistance, and when they occur together, the risk is significantly amplified. 4. Medication-induced diabetes. In some cases, the use of certain medications can increase the likelihood of developing type 2 diabetes. For example, some antipsychotic drugs, corticosteroids, and medications used to treat HIV/AIDS can interfere with glucose metabolism and contribute to insulin resistance. It is important for individuals taking these medications to be aware of this risk and to monitor their blood sugar levels regularly. Epidemiology of type 2 diabetes. The prevalence of type 2 diabetes is alarmingly high worldwide, making it a major public health concern. According to global statistics, approximately 89% of individuals with diabetes are diagnosed with type 2 diabetes mellitus. This figure highlights the widespread nature of the condition. While type 1 diabetes accounts for about 10% of diabetes cases, type 2 diabetes is far more common and often presents with a range of symptoms that can vary from person to person. The condition is particularly prevalent in developed countries where sedentary lifestyles and high-calorie diets are more common, but it is also rapidly increasing in developing countries due to urbanization and changing dietary habits. Symptoms of type 2 diabetes. Type 2 diabetes can affect various organ systems in the body, leading to a wide range of symptoms. While some individuals may not experience any symptoms in the early stages, others might present with several noticeable signs. 1. Polyuria, frequent urination. One of the hallmark symptoms of type 2 diabetes is polyuria, which refers to frequent urination with increased urine volume. Under normal circumstances, glucose is reabsorbed by the kidneys, but when blood glucose levels exceed a certain threshold, the kidneys cannot reabsorb all the glucose. As a result, glucose spills into the urine and water follows, leading to increased urine production. This increased frequency of urination can lead to dehydration, which can have additional consequences on overall health, including dry skin and increased thirst. 2. Polydipsia, increased thirst. Polydipsia, or increased thirst, is often associated with polyuria. As the body loses more water through frequent urination, individuals may experience persistent thirst and a need to consume larger quantities of fluids. This is the body's attempt to compensate for the fluid loss and to maintain proper hydration levels. However, simply drinking more water may not be enough to correct the underlying problem if blood sugar levels remain elevated. 3. Polyphagia, increased hunger. Another common symptom is polyphagia, which involves increased hunger and food consumption. Due to decreased insulin sensitivity, cells are unable to efficiently access and use glucose for energy production. This energy deficit signals the brain that the body needs more fuel, resulting in increased hunger levels as the body attempts to find alternative sources of energy. However, eating more food, particularly carbohydrates, can further elevate blood sugar levels, creating a vicious cycle. For fatigue, feeling tired and experiencing low energy is prevalent among individuals with type 2 diabetes. Elevated blood glucose levels and decreased insulin sensitivity can disrupt normal energy metabolism, leaving individuals feeling fatigued and worn out even with adequate rest. This chronic fatigue can affect daily activities and reduce overall quality of life. 5. Unintended weight loss. Although it might seem counterintuitive, weight loss can occur in type 2 diabetes, especially when the condition is not well controlled. Proper insulin functioning is necessary for fat storage, and impaired insulin sensitivity can prevent the body from effectively converting glucose into fat. Consequently, individuals may experience unexplained weight loss despite having a higher body mass index. This symptom is more common in the early stages of the disease and should be a red flag for further medical evaluation. 6. Vision changes. Blurry vision is another significant symptom of type 2 diabetes. Elevated glucose levels can cause osmotic effects, leading to swelling of the lens in the eye. Over time, poorly controlled diabetes can result in diabetic retinopathy, a condition that damages the blood vessels in the retina and can cause vision changes and even vision loss. Regular eye exams are crucial for individuals with diabetes to detect and manage any early signs of retinopathy. 7. Increased risk of infections. Individuals with type 2 diabetes may have a heightened susceptibility to infections. Diabetes can impair immune function, making it harder for the body to fight off infections. Common infections include respiratory tract infections, as well as fungal and yeast infections, particularly in warm, moist areas of the body. Poor wound healing is another issue that can arise, as high blood glucose levels can impair circulation and the body's ability to repair itself. 8. Paresthesias, numbness and tingling. Paresthesias, or sensations of numbness and tingling in the extremities, can occur due to peripheral neuropathy. This condition involves damage to the nerves, particularly those in the feet and hands, and can lead to discomfort and impaired sensory perception. Peripheral neuropathy is a common complication of diabetes and can significantly impact an individual's mobility and quality of life. 9. Delayed wound healing. Another notable symptom is delayed wound healing. High blood glucose levels and poor circulation, particularly in the extremities, can impair the body's ability to heal wounds efficiently. Peripheral neuropathy can further exacerbate this issue by reducing sensation and increasing the risk of injury. Individuals with diabetes should take extra care to monitor their feet and other areas prone to injury, and seek prompt medical attention for any cuts, blisters, or sores. Associated conditions. Type 2 diabetes can lead to several serious health conditions, particularly when poorly managed over extended periods. These associated conditions can have a profound impact on an individual's health and well-being. Diabetic retinopathy. This is a condition where elevated blood glucose levels damage the blood vessels in the retina, potentially leading to vision loss, cataracts, and glaucoma. Over time, the progression of diabetic retinopathy can result in significant vision impairment if not properly managed. Diabetic nephropathy. Diabetes can cause kidney damage, known as diabetic nephropathy. This condition can lead to chronic kidney disease, and in severe cases, kidney failure. The kidneys play a critical role in filtering waste products from the blood, and when they are damaged, this function is compromised. Early detection and management are key to slowing the progression of nephropathy and preventing kidney failure. Diabetic neuropathy, damage to the nerves, or diabetic neuropathy, can occur as a result of prolonged high blood sugar levels. This condition most commonly affects the legs and feet, leading to pain, numbness, and a loss of sensation. In severe cases, it can lead to foot ulcers, infections, and even the need for amputation. Regular foot care and monitoring are essential for individuals with diabetes to prevent these serious complications. Cardiovascular disease. Individuals with type 2 diabetes are at a higher risk of developing cardiovascular disease, including heart attacks, stroke, and peripheral artery disease. High blood sugar levels can damage blood vessels and contribute to the buildup of plaque, which narrows the arteries and restricts blood flow. Managing blood sugar levels, blood pressure, and cholesterol levels is crucial in reducing the risk of cardiovascular complications. Liver disease. Type 2 diabetes is also associated with an increased risk of non-alcoholic fatty liver disease, NAFLD, a condition in which excess fat builds up in the liver. NAFLD can lead to inflammation and scarring of the liver, and in severe cases, it can progress to cirrhosis and liver failure. Maintaining a healthy weight, eating a balanced diet, and managing blood sugar levels can help prevent or manage NAFLD in individuals with diabetes. Understanding type 2 diabetes is crucial for managing and mitigating its effects on health. By recognizing the symptoms and associated conditions, individuals can take proactive steps to manage their condition and improve their quality of life. For further information on type 2 diabetes, including its pathophysiology, diagnosis, and treatment options, I encourage you to explore additional resources and educational materials. Don't forget to like and subscribe for more videos like this. Thank you for watching, and I look forward to seeing you next time.